If someone is unresponsive and not breathing, here's how to give CPR and use a defibrillator. So first, if you come in, take a deep breath, clear your head. It's what they used to say, check for danger. It's about being aware of surroundings, making sure you're not putting yourself at risk, and ensuring that you have taken the time to breathe and clear your head. So you are going to do the right thing for the people you're trying to help. So you check for danger, you check for response, you speak to them, you tap them, and you check to see if there's any response at all. There is no response. You are then going to phone for the emergency services and put your phone on speaker. Carry on checking for breathing while you're waiting for the call handler to answer the call. And they will help you establish whether or not it really is a cardiac arrest or whether they are breathing normally, because sometimes it's quite difficult to establish. So when somebody is unresponsive or unconscious, you expect them to be completely floppy and lifeless. However, because of the lack of oxygen to the brain, it's possible that that person, that their arms might go up, or that they are panting, or they're having slow, laboured breathing called agonal gasps, where the lungs have stopped, well, the heart stopped working, but the lungs have still got a sort of reflex action going on. It's not proper breathing. It's not getting the oxygenation to the brain. But it's quite difficult to establish what is clear, normal breathing, and what isn't. So if you are on your own, you would check for danger, check for response, you open the airway, you tilt the head and lift the chin. So one hand on the head, 2 fingers on the chin, and then you would check for breathing. So you've got your phone on speaker, you are doing this while you're waiting for the call handler to answer. And you're looking for at least 2 normal breaths in a 10-second period. If you get 2 normal breaths in that 10-second period, you would put the person into the recovery position, providing you're not concerned that they may have fallen from a height or had some form of a spinal injury. In which case you would be very careful and you would monitor their airway closely and be ready to carefully roll them into the recovery position if their airway becomes blocked or obstructed in any way. So you check for danger, you've checked for response, you've opened the airway, you've checked for breathing, and there are less than 2 normal breaths in that 10-second period, or in up to 10 seconds. You are now going to have to do CPR. For an adult, you're going to be pushing down 30 compressions to 2 breaths. 30 to 2, 30 to 2, 30 to 2. When you're giving the breaths, each time you would tilt the head and lift the chin. If you haven't been on a first aid course and had a go on a mannequin and been trained to do this, and you are phoning the emergency services in this situation, the emergency services will talk you through compression only CPR. That is because learning how to tilt the head and lift the chin and open the airway is quite complicated in an emergency situation. So they will focus on the compressions and on you doing those hard and fast in the center of the chest, getting a defibrillator if you can, and doing this effectively whilst they get the emergency services on the way. If you have been trained in basic life support, doing the compressions and the breaths are important. They do give someone an even better chance of survival. So if you have been trained, you tell the call handler that you've been trained to do it, and they will adapt so that you can do the compressions and breaths. Okay, so just going back to recognizing that breathing, it's been shown that if somebody suddenly collapses, it's far more likely it's a cardiac arrest that has happened. So consequently, you need to be looking for those signs and be aware that if it's somebody that's been exercising and they're panting, that is also a sign that they could have a cardiac arrest. So if they have collapsed, they're unresponsive and they are panting, you should suspect cardiac arrest. And again, the call handler will help you to establish what you should be doing in those situations. So going back to our person, unresponsive and not breathing normally, we are doing 30 compressions. So heel of your hand, center of the chest. So for a female, it would be exactly the same. You're going to push down hard and fast on the sternum, so between the breasts. And please give CPR to females. Sadly, 25% of women are less likely to have a defibrillator used on them or to have CPR used in public. So exactly the same for a woman. Your breasts will just go sideways and you can actually get to the sternum. Okay, so you are going to be pushing down hard and fast in the center of the chest, on the sternum there, heel of your hand. You don't want to have too much weight on the ribs. So you're up over the top, pushing down hard and fast. 2 per second, 5 to 6 centimeters depth, and that will be circulating the blood to the heart and the brain. So when you are pushing on the chest, you are being the heart for them. When you're breathing into them, you are being the lungs. So you tilt the head and lift the chin to open the airway. So you're tilting the head and lifting the chin, opening the airway like that. You're holding the nose and you're breathing into them to re-oxygenate them. So that's what you are doing. You're breathing in just to the point where you inflate the lungs, and then you are doing 2 breaths and back to the compressions. If you are being taught how to do this or talked through how to do this by a call handler, then the call handler will just teach you how to do compressions. So please tell them you have been on a first aid course, if you have, and learnt how to do compressions and breaths, because that gives somebody an even better chance. So they will be just talking you through compressions because they will assume that you probably haven't been CPR trained. So it is too complicated in an emergency situation to try and teach someone how to tilt the head, open the airway and get the breaths down if they've never done it on a mannequin. Okay, so you're doing 30 compressions up over the top. You are pushing down hard as you can on the center of the chest. You are then tilting the head, lifting the chin, holding the nose and breathing in, giving 2 breaths and then back to the compressions again. You're calling for a defibrillator as quickly as you can. The faster you can get one on the chest, the better their chances. And you're going to put the pads, one here and one here. And again, doesn't matter if they're female or they're male, you're not going to put the pads on top of breast tissue. You're just going to put them up here and under the armpit on this side. So you would peel off one side here, one side here. You can put it this way round or you can put it this way round. It's up by the armpit, just under the armpit, and it's across the ventricles of the heart. So you're getting the maximum adhesion to get that shock going across there. The defibrillator talks to you. It will tell you what to do. It will tell you when to stand clear. It will tell you when to give a shock or when it's giving a shock if it's an automatic one, and you just follow the prompts and keep going. The ambulance is on its way and you're giving this person the very best chance. Cardiac arrest can happen at any age, and sadly children do die from cardiac arrest. And cardiac arrest can happen from multiple different causes. For a child, it is usually a breathing problem that has happened first. And lack of oxygen to the brain is actually a reversible cause of cardiac arrest. So that is why we would be giving breaths first to a child that has collapsed. So if you find somebody that is unresponsive, you're going to come in, you're going to check for danger. Check for danger really, as well as being aware of what's going on around you. It's about giving yourself time to take a deep breath and clear your head and make sure you are going to do the best thing for this child in a very scary situation. So take a deep breath, make sure it is safe for you, and whatever has caused them to have a cardiac arrest or collapse is not going to injure you, because you are the hope for that child, and you're going to be there to help them. So you check for danger, you're then going to check for response. So you speak to them and you touch them. No response. Now I'm going to open the airway, so tilt the head and lift their chin. So two hands, a hand on the head and two fingers under their chin to open the airway. So two fingers here, one hand here, and I'm opening their airway. And then I'm going to look, listen and feel to see if they are breathing normally. I'm looking out for abnormal signs such as slow laboured breathing, agonal gasps where you sort of breathe and then you wait for an awful long time and nothing happens, panting, anything unusual. I'm getting the emergency services on the phone. I'm putting my phone on speaker and I'm checking for breathing whilst I'm waiting for the call handler to answer. Okay, so if they are unresponsive and breathing normally, I am going to be rolling them into the recovery position to protect their airway, unless I'm very concerned that they may have had a serious spinal injury. If they are unresponsive and not breathing normally, I'm going to start immediately by giving them 5 breaths. So I'm going to tilt the head, lift the chin, hold the nose and breathe into them. Giving 5 breaths. And then I'm going to be pushing down, centre of the chest. If you have been paediatric first aid trained, you are going to learn 15 compressions to 2 breaths. So 5 breaths first, 15 compressions. So and back to 2 breaths, okay? And then I give 2 breaths and then be back to 15 compressions again, okay? I would be calling for a defibrillator, and the defibrillator pads for a child, if it's a child under 8, I would ideally like you to be using a paediatric setting on your defibrillator or paediatric pads. For a child under 8 or under 25 kilograms, you would ideally use the paediatric setting on your defibrillator or paediatric pads. If you have these, you would put one on the center of the chest, but to the left of the midline, so like this. And the other one goes on the back of the chest, but right in the middle, in the center. If you haven't got access to a paediatric pads or a paediatric setting on your defibrillator, you can use adult pads, and you would put, again, one on the front and one on the back. Adult pads tend to be much bigger and you may not have room to put it to the left of centre. If you can though, that is what you would do, to the left of centre on the front and in the middle on the back. When you're classifying children, they are classified as 0 to 1 for a baby, 1 to 12 for a child, and 12 to 18 or 13 to 18, it's a grey area around that puberty time, for an adolescent or as an adolescent. So an adolescent will have the adult CPR positioning of the pads, providing they're post-puberty, but they will still have 5 breaths first when you are giving compressions and breaths. So for any paediatric, so that's anyone under the age of 18, you will start with 5 breaths, 15 compressions if you've been paediatric trained, to 2 breaths. So 5 breaths first, 15 to 2, 15 to 2. For a child, you will be doing 5 breaths first, 15 compressions to 2 breaths, and you can probably manage with 1 hand. For an adolescent, you're likely to need 2 hands, and for a baby, you would use 2 thumbs in the thumb encircling technique. Cardiac arrest can happen in any age, and sadly it can happen for a baby. For babies and children, it's far more likely they've experienced a breathing problem before their heart has actually had the issue. And lack of oxygenation to your brain is a reversible cause of cardiac arrest. And that's why breaths are so important in terms of child and paediatric resuscitation. Adults retain oxygen in their system once they've had a cardiac arrest. Not for very long, but for a few minutes, they will still have oxygenated blood in their system. Babies and children don't retain oxygen in their blood like that. And for babies and children, they're also far more likely to have had a breathing problem, so their oxygen levels are already depleted. Consequently, when we're giving baby and child CPR, we are starting with 5 breaths. So just to go back to the beginning. So you've come in and you found the baby is unresponsive. You're going to come in, you're going to take a deep breath and just clear your head. That way you have a much better chance in a very stressful situation of doing your very best and keeping that panic at bay. You're also keeping an eye open and checking there's nothing dangerous that they've managed to get hold of that's going to injure you as well. So you come in, check for danger, there's no danger, you've taken your deep breath, you've checked for response, you've spoken to them, you've tapped them or scraped the bottom of their foot with your finger, and there is no response. You now need to open the airway and check for breathing. For a baby, 1 hand on the head, 2 fingers under their chin, and you just go to horizontal. You never want to overextend a baby's airway because that can block it again. It's the way they're made. So quite often their chin will go forward like that, and you just tilt the head and lift their chin to horizontal like that, okay? And then you would check for breathing. You've got your phone, you put your phone on speakerphone and phone the emergency services, and you're doing all this while you're waiting for the call handler to answer, okay? If they are unresponsive and they're breathing normally and you're confident that they're breathing normally, then you would put them into the recovery position so that you would maintain their airway. So you would put them into a position like that, or you would roll them onto their side and put something here to keep them on their side and keep checking that they are breathing. If they are unresponsive and not breathing normally, you are going to start with 5 breaths. So you've tilted the head, lift their chin to horizontal. You're going to seal your mouth around their mouth and nose because of the size of it is too difficult to hold their nose and breathe in. So you're going to cover both and puff with a puff of your cheeks. Their little lungs are about the size of a tea bag. So you don't want to breathe in too much to inflate their lungs. You're just doing a quick puff to inflate their lungs. Five breaths, and then you're going to do compressions. So the thumb encircling technique is the best way to do this. So 2 thumbs, one on top of the other, on the sternum, in the centre of their chest, between the nipples, and you're holding your fingers around like this, but you're not pressing on their ribs, you're not squeezing like that, you're just pushing down with your thumbs like this. And you're doing 15 compressions if you've been paediatric first aid trained, to 2 breaths. And I'm not sure, I might have lost count at that point. And do you know what? It doesn't matter. It's not an exact science, the 15 to 2, but roughly 15, going back to 2 breaths and then back to your compressions again. Pushing down hard and fast by about 1/3 of the depth of their chest, because when you're pushing on the chest, you're being the heart. When you're breathing into them, you're being the lungs. You're being a heart and lung machine for them. You've got the emergency services on the way. You've also shouted for a defibrillator. And if there is a defibrillator nearby, if they have paediatric pads in a paediatric setting, you would put 1 pad on the centre of the chest, but just to the left, if you can. You're doing this on the baby's bare chest, and you would put it to the left side of the centre. And the other pad goes on the back. But again, you're doing that on their bare skin. And then you're doing the compressions on top. If you haven't got paediatric pads or a paediatric setting, and the baby is unconscious and not breathing, you can still use adult pads. You would put one on the centre of the chest. There's going to be no room to put it for one side or the other, and one on the back. It's unlikely that they will be in a shockable rhythm. So it's unlikely that the defibrillator will let you shock. But if it does, then it means that that child was in a shockable rhythm, and any shock is better than no shock. You've got the emergency services on the way. You keep going. You're giving compressions and breaths, compressions and breaths. And as I say, the emergency services are on the way. Thank you for listening. If you found this helpful, please share with others. We have a wealth of free resources on our websites, www.firstaidforlife.org.uk and onlinefirstaid.com. You can also subscribe to our channel.